So my practice is not necessarily a boutique practice. We're a busy practice. We take all sorts of insurances, and the number one thing that I want to implement in my practice is efficiency. I want to do things right the first time and not have to repeat any steps. And again, as a complementary technology, Solea has been very helpful because it just blends everything together, especially if I'm doing a quadrant of fillings. I can quickly start using the Solea. I don't really necessarily have to numb. I can fit in a patient that wasn't on the schedule if time permits and get things done, obviously making the office more productive and profitable. So if I'm doing a CEREC procedure, for example, if I'm doing a preparation that has deep margins or below the gum line, there's decay below the gum line, I just quickly take out my Solea and I will remove all the gum tissue. I'll clean out the decay. And what tends to happen is, in the past I used to use a burr or something on those lines and the gum tissue would bleed a lot, and now I have to work very hard on stopping the bleeding and then isolate everything, then seal and build up everything. But the beauty about Solea is, because it's a laser, it doesn't make the gum tissue bleed a whole lot. So once I'm done cleaning the tissue, I'll clean out the decay right with the Solea. And because there is no bleeding, I can isolate it and quickly build it up and get things done more efficiently.